Good afternoon, everyone. My name is Christine Barges. I'm the Director of Technical Assistance and Research at the National Council of Urban Indian Health, and I want to welcome you to today's webinar with AAAHC. That will be an overview and introduction of the AAAHC process. I wanted to let you all know about what to expect on today's call. There will be a presentation by representatives from AAAHC. And then at the end, we'll actually open it up for questions and answers, as well as opportunities for the community of learning. For those of you who are not familiar with communities of learning through NCUE, this is an opportunity for the Urban Indian Health programs to link up with their peers around specific topic areas. And also on today's call during the presentation, you're going to hear more about a AAAHC community of learning that will be starting in September. And so at the end of this call, we'll be talking to you all, for those of you who want to participate in that community of learning, so that you can link with your peers around accreditation, as well as link to experts from AAAHC as you're going through your process. We'll give you more information about how to join that at the end. So with no further ado, I want to go ahead and introduce our speakers for today. We have Mashan Villanueva, who's the director, and Marcia Wallander, who's the associate director of AAAHC, and they're going to provide an introduction to the accreditation process. So I'll go ahead and turn it over to them.
Well, good afternoon, everyone. Thank you so much for joining us today. I hope that throughout this time period, we'll be able to provide you with an overview of AAAHC, as well as the accreditation process that's hopefully helpful to you as you endeavor in your accreditation roadmap.
My name is Marcia Wallander. I'm so happy to be here with you today. I have made the acquaintance of several Indian healthcare clinics through my 6 years of working here at AAAHC, and I look forward to helping you in the future as you need it.
Assistance is that's moving forward. We want to talk about the objectives of the program. Hopefully you have materials in front of you, but as Marcia continues to work to advance the slide, we can talk about how we're going to structure this presentation today. First, we're going to talk about what is accreditation. I'm sure a lot of you may have questions about that, and we want to make sure that we provide you an overview of AAAHC and what we can do to help you prepare.
We sort of outlined the program today in a format that gets you ready, helps you prepare, and then says, go, let's go for it. We're going to talk about some of the things that you need to do for planning. We're going to talk about how to prepare for a successful on-site survey experience. And then we're going to talk about what to expect after your survey, and what you might have to do if there are deficiencies that are found. So the first part that we're going to talk about is how to get ready.
Now let's talk a little bit about AAAHC, our background. We've been around since 1979. We are a not-for-profit organization. Our acronym, AAAHC, stands for the Accreditation Association for Ambulatory Healthcare, and that has been our exclusive focus since since our inception. We have well over 5,500 accredited organizations, and as you can see from the list here, we have quite the variety of the various settings, practice settings there are. They're primary care, surgically based organizations, as well as other types of organizations, including employer-based health clinics, as well as retail clinics.
And Mashan, let's not forget also that we currently accredit over 100 Indian health organizations that have multiple sites around the country. I was privileged to attend a survey in Arizona. It was an incredible experience, and I hope that we can bring that same experience to you should you choose AAAHC accreditation. One of the things that does set our programs apart is that we always include a scheduled personal survey visit to observe and interview and get to understand your organization and how it is performing against the standards that happen to be current. Our surveyors, we have about, I think, Michonne, about 350 surveyors right now.
Absolutely.
And we do require them to go through retraining every 2 years, and they are privileged to provide surveys in specific settings. So I want to emphasize to you that should you move ahead with AAAHC accreditation, we will be scheduling a surveyor who has experience in surveying Indian health clinics and who has undergone some very current training. So how to get ready? You know, I think before you can choose who your accreditor might be, you need to know what the benefits of any accreditation organization might be. I think one of the benefits of AAAHC accreditation is the recognition and validation that you will get for the quality of care that we all know that you are providing right now. We always have a consultative and an educational approach. We do not promote ourselves as inspectors. We don't come out to pass any type of judgment on you or the care that you're rendering. We are trying to see that your care is delivered in a safe way and in a quality way, and to try to help you with suggestions and ideas and observations to increase that quality and safety of care. I worked with a regional Indian health office, and the leader of that office had wonderful things to say about using his organization's AAAHC accreditation as a recruitment tool, both for providers and for staff members. And I think that you might spend a little bit of time thinking about how you might use a successful accreditation survey with a potential provider candidate. I think that providers are always looking for ways to measure a prospective employer, and I think promoting your accreditation would be a great benefit to you in that recruitment and retention. I think also one of the benefits of accreditation is the confidence that patients will be provided knowing that you have successfully passed an outside event that has looked at your processes and your written policies and how those are implemented in actually day-to-day, patient-to-patient care. I think that that will give your patients and their families a level of confidence in the care that you render. And I always like to include that all of our surveys, all of our organizations receive a very comprehensive written survey report. It's about 160 pages long, and the surveyors provide many comments and suggestions and thoughts for your consideration. And if you should incur a deficiency during the course of the survey, you will see that in your written survey report, and you can use that as sort of a built-in planning tool for how to make improvements in those deficiencies.
As you can see in our accreditation handbook, which is our comprehensive manual of our standards, and everything you need to know about the accreditation process is contained within that handbook, there are the standards that will be evaluated during the survey. We start off with our core chapters, which are applied to every organization that seeks an accreditation survey. And as you see from the list here, they really do promote the fact that patients are number one, and we promote safety and providing care in a safe and sanitary environment. So beginning with patient rights and responsibilities, it's up to the governance of the organization to ensure the appropriate administration of the organization, the quality of care that's provided in the organization, and then ultimately the quality management and improvement process is comprehensive throughout the organization. The clinical records and health information system will be reviewed. The infection prevention and control and safety programs are going to be reviewed, as well as the facilities and environment. And that chapter is really evaluated for providing care in the best possible setting, ensuring that the environment in which the care is provided is safe and sanitary. Moving on to the adjunct chapters, these chapters are applied based upon services that are provided by the organization. Many of you will probably experience that a majority of these chapters may not apply, but those that might be relevant to your organizations would include such as dental services, behavioral health, medical, home. Those are the types of chapters that could be applicable. Marcia, do you have any additional input?
Well, I was going to ask you a question, Michonne. It seems from listening to you say that if I were a clinic that did not provide dental services, then your surveyor would not be evaluating us on that dental chapter. Is that right?
That is correct.
So you've spent a little time in getting ready. Now it's time to get set for your own accreditation. How do you go about planning that? Well, the first thing is to get your hands on the current Handbook of Standards, and working with Jamie and Kim, I can help you to do that. All of our handbooks are available in a variety of formats. If you'd rather have it electronically, we can supply it that way. But I know that many people are still in the paper mode, and I actually like the paper because it's set up in a notebook style, and when I find additional helps or tools that relate to a specific standard, I can just three-hole punch that and put it right in the right place so I always know where things are. But the standards are available in a variety of formats so we can meet your needs. All of the handbooks are set up in a self-assessment format, and you'll be able to use that self-assessment format by delegating, for example, the chapter on clinical records to your clinical record person. I always like to tell people who are fairly new to accreditation that you've got to make this a team sport. It's not something that one person should have to or could be able to accomplish, you know, with all of the other duties that I know that you have on your plate. So you're gonna learn to identify some champions, and that doesn't always mean, for example, in the clinical records example I used, that might not be the director of clinical records, but perhaps it's a person who's really interested in the department and making some improvements, who you could engage that would be helpful to you, and could be your champion for making any changes that might be needed in the medical record department.
Marcia, I'd like to also add for our audience that within our handbook products, certainly, as you heard Marcia say, there are different formats, but one of the great things about the formats that we offer is there are interactive worksheets that are available so that you could, in fact, conduct a self-assessment of your clinical records, your personnel records, your credential records, and so forth. And it really is interactive and used as, again, an assessment tool, and they're electronically based. So hopefully you'll find that helpful as well.
That's a great comment, Michonne, and I sometimes encourage organizations to delegate those worksheets, you know, 1 month or 1 quarter to one person, and then use a different person, you know, a couple of months later, so that you can engage others in seeing how you're doing. Michonne and I have been talking with the leaders from the Urban Institute for Indian Health, and we would like to arrange a community of learning. And I think that we'd like to invite you to participate in that by letting us know what your needs are. I might suggest that we think about, you know, having a monthly phone call or a monthly webinar presentation, perhaps on a solo topic, that's of concern for the majority of participants. We have some AAAHC accredited organizations that are members, and we'd like to invite those people to rather act as mentors for others who might really appreciate having someone with very similar experiences and needs to foster together in a community of learning so that we can all benefit from that. Another thing that you're going to have to think about is to creating an action plan to resolve issues that you are aware of or that you learn of through your self-assessment of your organization. And we can help you with that, but you're really the people who know your organization, and we'd be happy to brainstorm with you about which topics might require more time or more energy, and we can certainly offer you some insight into how other organizations have improved their own patient rights or clinical records or whatever your personal topic is that you're trying to improve. So I think through the community of learning and through interacting with one another and being available to one another, that we can truly help you deliver a great level of care to your patients. One of the last things that you're going to have to do is to determine what your own timeline is. The application for AAAHC survey is electronic, and it has, I think, many convenient features that you'll learn to appreciate. Those features include being able to save your work and come back to it at a different time. It allows the primary contact person to share the application. So if you want someone else to perhaps input some demographic information into that application, you can control that. So I think it's a handy improvement for those of you who have been accredited in the past and perhaps filled out the paper application. You're going to love the electronic version. It's important for you to know when you're trying to determine your timeline that an application for survey is valid for 6 months. So we can help each of you try to determine the appropriate timeline. But you must remember that that application stays valid for 6 months of time with us. So you've got the handbook, you did your self-assessment, you filled out your application, it was accepted here at AAAHC, and you're all set.
Absolutely, and that application has been determined to be complete. Now, as you will see within the application process, there are documents that are necessary to complete that application, and they can be uploaded, and you'll find those features very easy to use, typically uploading PDF documents. Again, the application is very user-friendly, and you can come and go as you please, and when you have determined the application is complete, you hit send and it is submitted here to AAAHC. There is a review process that happens once the application has been received here. There will be communication by our applications coordinator who will acknowledge receipt of the application and let you know if there are any additional items that are necessary. At this point, the application has been determined to be complete and accepted. You will then begin to work with the scheduling coordinator who will work with you to determine a mutually agreeable date. This is an announced survey. We want to work with you within a time frame that you determine is best for your organization. The best thing is we get to interact with the organization representatives, the various folks in the center. This is a great opportunity for that type of interaction. But again, we want to arrive when you have determined it is best for your organization. And we do want to arrive when you're open and have active practice going on, so we can observe that practice going on, as well as talk to individual folks. Once the application has, once the scheduling commences, the next is the accreditation survey fee. Now, certainly we don't have annual fees that are part of our process. We don't have renewal fees. We do have an application fee that is non-refundable, that is submitted with your application. And again, that initiates the accreditation process. We also have a great feature with our accredited organizations that once you become accredited, there is an opportunity to work with our Institute for Quality Improvement for benchmarking and benchmarking activities. So hopefully you'll take full advantage of that wonderful feature of our accreditation. As you can see here, we've tried to provide an estimate of what potential costs could be for an organization to seek accreditation.
And please remember that these are only estimates. For example, those of you at a small clinic that maybe only have 1 or 2 providers and, you know, maybe 3 or 4 exam rooms, the cost of your survey is going to be significantly less than $9,000. We base our survey fees, remember that we're a not-for-profit, our survey fees are based on the information that you provide in your application. And we can help you get a better handle on a closer estimate of price if you just give us a call, and our phone numbers and our contact information are coming up here a little bit later in the presentation. And just through talking on the phone, we can determine what a more realistic cost estimate for you might be. Also, Michelle, it's a nice feature, I think, that once an organization does become accredited, they receive an electronic version of the annual handbook of standards every year at no cost. So, what does a survey event actually look like? Well, you heard me just say that our surveys are based on the information that's contained in your application. We look at things like, do you have a satellite? And if you do, how far away from the main office location is that? So generally, our surveys for Indian health centers have been 1 to 2 days long with 1 to 2 surveyors. Now, there's always outliers, that small practice or the great big practice, or one that maybe has a satellite that's 300 miles away from the main office. The surveyors will arrive at the appointed day. Remember, this is an announced survey, so you and I will work together to determine the appropriate date. The surveyors will enter your organization and introduce themselves. They'll have what we call an opening conference, which is where they introduce themselves and give a brief overview of how they think the next day or 2 is going to go. They'll let you know during that opening conference which medical records they might want to review, which, if you have a medical director on site or your clinical record person is on site, they'll be asking for an introduction to some of the folks from your organization and trying to put a little structure in the 1 or 2 days that they'll be with you. They do documentation reviews by looking through your provider credentialing files and your staff files, also reviewing your QI program and the various QI monitoring or activities that you engage in, including your QI studies. And they'll be looking through some clinical records as well. They gather lots of information, and as Michonne mentioned to you, there is a worksheet in the back of the Handbook of Standards for review of your clinical records. So you could use that. It's the same sheet, actually, that our surveyors use. So you can use that worksheet from the back of the handbook to do an assessment of your clinical records before we even come on site. The surveyors will also be walking around and looking at your physical environment, and they'll be engaging in some personal interactions with your staff, with your providers, with patients, and while they're walking around and talking with folks, they'll also be making some observations. So there's a lot of work that goes on, a lot of information that goes on during the time that the surveyor's on site with you. I like to encourage organizations to take advantage of the surveyor that you have. They go to lots of different Indian health clinics. They've seen lots of different attempts made to, improve, this or that. And you can engage them and ask them, do they have any ideas or suggestions, or have they seen a particular process in place, and were the results of that good or better than what is going on right now? Take advantage of those people. It's very, very common for staff and providers to sometimes feel a level of anxiety when they feel like outside eyes are, looking at what they're doing. But I will strongly encourage you to engage your surveyor and take advantage of their experience and knowledge.
Now, following the survey, after they've had time, the surveyors will be working with the organization to conduct a summation at the end of the survey. At that point in time, that's a great point of conversation the organization can have with regard to any areas of clarity that are necessary from the surveyors, and just making sure that all areas have been covered by the survey team. The survey team, once it has completed its survey, will work on its survey report, which they will submit to HHHC. This is if there is more than one surveyor, this is a coordinated effort to document completely the survey report so that it reflects what they found during your survey. Again, this is your story, and they want to tell it in the most accurate way possible, and also making sure that they both participate, or however many surveyors are part of that team will participate in completing that survey report. That survey report is submitted to the HHHC office, and it is reviewed. And that review process happens with our staff, and they are just simply there to make sure that all the areas are covered, and that the report can be prepared for review by the accreditation committee. Now, the accreditation committee is made up of various surveyors in various areas. They are physicians, nurses, administrative surveyors, and they're active surveyors. So they are the body that makes accreditation decisions for each and every organization that seeks accreditation. Once that decision has been determined, the organization is informed by way of an accreditation decision letter and a survey report that, again, is the comprehensive review of that organization, and again describes what was found during that snapshot in time of the organization. And again, the organization should be aware that HHHC grants accreditation in terms of 3 years and non-accreditation. But again, we look for every opportunity for successful organizations, and so granting accreditation is one of the things that certainly will help move an organization forward to further improvement, but getting that accreditation decision letter and survey report is quite the accomplishment for any organization.
So I know that once the surveyors leave your building, there's rather a small collective sigh of, okay, we got through that. But once you get your decision letter, it's time to celebrate your success. We have a savvy marketing department here who has prepared a kit for you that's got lots of ideas on how to promote your newly attained status and how to market your organization's accreditation. You're also going to want to review that survey report with various people within your organization to decide what things need to be improved and how you're going to go about making those improvements. Based on that review of your survey report, you can create a prioritized action plan so that when we come back to visit you again in 3 years, those deficiencies will have been made substantially compliant. We are arranged internally here by teams, and we do have a primary care team. These are the people that would help you with questions about applications or about scheduling of a survey, or if you need to speak to the manager of the primary care team. We've provided here the direct dial telephone numbers as well as the emails. If you have any questions at all about anything that Michonne and I have said today, or if you think of something that we didn't touch on today, you can send Michonne or I an email or a phone call, or if you know specifically what your question is about, you can just go right ahead and contact these people. We'll be very happy to help you in any way we can. Here is the contact information for Michonne and for myself. And I've also at the bottom of the slide provided the website address. If you haven't had the opportunity to browse around on the website, you might find that very helpful to you, particularly as you answer questions about accreditation with your board members or providers who are not able to be present on today's phone call. So I think this concludes our brief introduction of ourselves and of the accreditation process here at AAAHC. And we thank you very much for the time that you've taken from your day to spend with us. And we'd like to answer any questions that you might have right now. So I'm going to turn the program back over to Jamie or Kim, and we're happy to take any questions that you might have.
I would just like to thank AAAHC, Michonne and Marcia, for giving us that very interesting and educational overview over AAAHC. I know that a lot of our programs are very interested in trying to move towards getting accredited, and so we're very gracious for you coming on board and providing them with this overview. I also wanted to emphasize that we are planning to hold a Communities of Learning coming in the fall through NCUE. So if you are interested in joining in on that Communities of Learning, which will allow you a little more in-depth information on some of the topics that are required in the standards for AAAHC. I know that Marcia and Michonne will be working with us closely in that Communities of Learning, and we would be very happy if you could join us in that. But if you can, please send us your name, your information if you are interested. My name is Kimberly Fowler, and you can reach me at the email address and phone number listed on your screen, and we'll do our best to make sure that you get involved in that Communities of Learning coming up in the fall. And at this point, if there are any questions from anyone that is on the webinar, if you like, you can actually type those into your chat box. And we do have a little bit of time, so we could answer some of those questions if there are any questions from any of the participants. Okay, there's one question that is asking, are you offering any mock survey services through NCUE? Currently, we are just preparing for our Communities of Learning. And hopefully in the future we'll be able to help more thoroughly with that process. There may be opportunities as we partner and collaborate with AAAHC for that to happen. So just stay in touch and hopefully we'll be able to give you more information on that. Oh, there's one more question, I'm sorry. The question is asking, can NCUE help in developing quality improvement programs and studies? And the answer to that is absolutely yes. Our Technical Assistance and Research Center is definitely willing to help you with that process.
Jamie, this is Marcia. It's also of interest to the person who's asking a question about quality improvement to know that not only is there a chapter devoted to quality improvement in the handbook, in the back of the handbook resources is several pages of how to get started with creating a study. AAAHC has designed what we refer to as a 10-element program, and the resource from the back of the handbook actually is sort of set up like a worksheet that helps people understand, okay, what's the first thing I need to do? And you need to, decide on what your topic is. So we've provided some helps for you to pick a pertinent topic. So the 10-element worksheet rather walks someone through the entire QI study creation. It's really a very valuable tool, and I would be happy to share a copy of that with you if the person who asked the question lets Jamie know an email address where I can send that.
That would be great, Marcia, if you could do that. This is Kimberly. Sorry, I think Jamie unfortunately dropped off the call, but if you are able to, I can actually send her your information and or send her information on to you in order to get a copy of that information.
Well,
and if it's possible, if we could actually be able to share that with our programs in general, just let us know after the call. And I think it's a very good point that you made about working with the AAAHC handbook. You did mention that that is available for purchase, and so it does contain a lot of good information on preparing for accreditation, and so I would encourage all of our members, if you're able to go out and purchase that handbook, just to give you an overview of all of the standards that are required, as well as to give you a general idea of some of the questions that may be asked on the site visit.
Well, actually, Kim, I will tell you that we'd love to be able to provide that to all of your attendees for free. We can provide that, and they can see how it can be such a useful tool, and we'll provide it to them electronically, so again, they can take full advantage of those interactive worksheets.
Okay, that would be awesome. Thank you. We actually have two other questions I just want to get to. One question is, how would the quality improvement study overlap with IPC program work we may be involved in?
Well, we're of the mind that we never like organizations to have to go through double duty. The quality improvement studies that might be part of AAAHC would also be satisfying the improved patient care that is such a great program. I've actually accessed that website myself several times. There's some great information there, but we don't want to make you do double work. So the answer to the question is that a study completed would meet the requirements of both of those programs.
Okay, thank you. I have another question for you. The question it's asking, we have the 2012 handbook. Is there one for 2013? And if so, is there a big difference?
There is a new edition in 2013, and while there are a number of changes as demonstrated in Appendix A, and Appendix A is every year a listing of the changes that have occurred from the prior year's version, the changes have been to make the standards more succinct and clarify areas that may have needed additional clarification. So while there appears to have been a lot of changes, they were not of significant substance that an organization that has a 2012 couldn't still meet a 2013 survey. But again, we'll provide your audience with the 2013 handbook.
We've actually been asked that question several times, Kim, by many of our accredited organizations. And my general response is that although it seems that there are a lot of changes for 2013, they're not new standards. They've just been relocated or the language has been clarified. The intent of the standards has remained fairly stable.
Okay, thank you for answering that. Were there any other questions from the participants? Actually, I just had a quick question in listening to your presentation. You mentioned that if there are several locations or sites within one organization, that they would have to survey all of those sites. I know there are several instances of some of our programs that do have several satellite sites. So when coming out for that survey visit, is it a requirement of all of the sites to be surveyed or just the main site in order to be accredited?
It is not a requirement that all sites be visited. We determine which sites we go to based on a couple of things. And those things are the types of services that are provided. Let's just say that you have a big primary care main location and you have 3 satellite locations, so four sites altogether. One of those sites delivers only pediatric care, nothing else. So we probably would want to see that site in addition to the main site. So we like to be able to see all of the different service lines. Using another example, if you had 4 sites and only one of them provided dental care, we'd probably want to see that location that provided the dental care. So going back again to the few words that we offered you about the application process, our surveys are determined based on the information that's provided in the application. So not all sites are necessarily visited, but we won't know that until we are able to see the application itself and get a visual picture of what we're going to be looking at. Nishan and I sometimes giggle between the two of us. Our favorite answer in accreditation is, it depends. We like to tailor our surveys very closely. We're trying to watch expenses. We're trying to be cognizant of the time that our organizations are devoting to a survey event. So it depends, but we're happy to, talk you through a question about a specific organization to give you some reassurance.
Okay, thank you for answering my question. I'd just like to open it up again to ask if there are any other questions. We have about 5 more minutes or so, if anyone else has any more burning questions that they would like to ask.
While people are thinking about that, Kim, maybe I'll just offer a comment or two. It's been a great privilege for me to work with the 5,800 or so accredited organizations that we currently have. I learned so much in talking with each of them, and I feel that I'm able to take what I've learned and pass it back to others when they're in need. So it's really a great partnership, I believe, that AAAHC has with its accredited organizations. We're here to partner with you. Our own mission is improving quality and safety. So I think that our own mission fits very well with the mission for NCUE.
Okay, thank you. Actually, while we're waiting also, Jamie and I actually had the opportunity to attend one of your Getting Accredited workshops back last year, years ago almost. So I was just wondering if you could give a little information on what that workshop or seminar is about and what would be the benefits of our members attending that.
Well, I think that is an excellent opportunity for our organizations that are thinking about accreditation or preparing for accreditation to go to. They are held 4 times a year across the United States. We try to match them up regionally as far as trying to get people, allow for accessible travel, if you will. This year, we've got our program coming up in St. Louis in September, and I invite your attendees to really consider going to one of these programs because, again, it's a 2-day session that allows for, first of all, an overview of the accreditation standards, the policies and procedures, those type of areas within our accreditation handbook, and it is taught by our own surveyor faculty. These are the surveyors that are actually out surveying various types of organizations. They serve as faculty to teach our organizations or those who are interested in accreditation about accreditation. The first day is really to go over the standards and allow for some questions and answers with regard to how the standards apply. The second half of the day, the first day, is devoted to breaking out into a session that puts into groups organizations that are alike, such as Indian Health Centers would have a group that is led by a surveyor facilitator, and they're there to talk about various standards and how they apply. They go through a quality improvement activity as well. They're looking at how this quality improvement activity is structured, and they work through it together. It's a great opportunity for networking. And the great thing about it is that there are a great diversity amongst the group in itself, that some organizations are sending people that have been through an accreditation survey or are there for a refresher, or those that are sending people for the first time that really they have had no exposure to accreditation or to AAAC. So it really is a great opportunity for a lot of exchange. The second day, again, is breaking out into those groups to discuss the adjunct chapters, as well as in the afternoon, there are elective sessions that are provided. And again, the organization, the audience can choose what's best for them. We have sessions that talk about how to prepare for an accreditation survey, why choose AAAHC, so it gives them great background on how an organization can determine if AAAHC is the right accreditation organization for them, as well as there are surgically based sessions that are focused on those organizations that provide outpatient surgery and those that provide primary care services. So again, tailored to our audience, and our audience can pick which session which is appropriate for them. And most importantly for us is our medical home presentation as well. There's a session that's dedicated to our medical home accreditation, and these are sessions that any of you, the attendees that are joining this program, can sign up for. And they're held 4 times a year. As I mentioned, September is St. Louis, and a great draw is Las Vegas in December. Every December we have our Vegas program, and it's one of our biggest every year. And we find that organizations come back again to learn more about what's new for the current year.
Generally, we have about 200 to 300 people at these Achieving Accreditation conferences. So you're bound to be able to make some great networking contacts that can help you going forward into the future.
Great, thank you. Well, we're at the top of the hour, so I do want to be mindful of everyone's time. But I do once again want to thank you, Michonne and Marcia, for giving us this thorough introduction to AAAHC. Once again, if you do have any questions for the team at AAAHC, please feel free to reach out to them at the information that they listed previously. And also, if you are interested in our AAAHC Community Learning that will be starting up in the fall, please shoot me an email or give me a phone call at the office so that we can make sure get put onto that list. So I thank you all for joining us, and I appreciate all of your comments and all of your questions, and I wish that you have a great rest of the day. Thank you.